This year's summer camp is back, but not without safety measures and some modifications. In today's It's Your Health segment, Dr. Gabe Schifman, board-certified pediatric emergency medicine physician at Overland Park Regional Medical Center, talks about how you can help your kids have fun while following best practices and also staying safe and healthy. Good afternoon, doctor. How are you?
Great. How are you?
I'm great. So let's get right into this. The pandemic, it's changed a lot of things for us so far, last year especially. So how can kids rebuild relationships in a safe and healthy way through summer camps this year?
Well, I think it's important to ask them the questions like, are you practicing social distancing and cohorting those who are exposed? Is there a way to cleanse all the surfaces afterwards? Just the basic stuff that makes sure that camp has policies in place. And also, if they're 12 and older, it's really important for all those children who are 12 and older to get the vaccine against COVID-19. That's the only true way to prevent them from getting the disease.
Speaking of vaccines, we know that doctor's appointments were missed last year. Should kids be up to date on those other vaccines before going to summer camp?
Most camps do require a physical examination by their PCP within a year of attending camp and making sure that all their shots are up to date.
We know with kids, summer camp means swimming. So how can parents make sure that their kids are water safe this summer?
Having them learn how to swim is the most important thing you can do. Besides that, making sure that the camps have adequate safety mechanisms in place, lifeguards, life jackets. Every child, whether they can swim or not swim, should always have a life jacket on them around a natural body of water. So that's a lake, a river, or an ocean. Because noodles and those floaty toys don't count. It's not as safe.
So we talked about washing hands and cleaning surfaces. Is there anything kids should take with them to summer camp?
I think bringing masks, bringing hand sanitizer is important against the virus and other viruses. But then in terms of just normal everyday camp activities, sunscreen, insect repellent, clothing that protects you from the elements, hats, sunglasses, those are all standard that every child should be careful and make sure they're being safe.
Let's talk about food allergies, though. How do you suggest kids eat safely at summer camp?
Well, I think it's important that every camp knows what your child is allergic to. So whether it be food, whether it be medications or elements in nature. So if your camp knows the allergies, they can better prepare to not serve those items, obviously, and to prevent exposure to them. It's also important that your child, if they do have a history of anaphylaxis, to bring an EpiPen, an epinephrine pen. If they don't have one, make sure the camp does have one.
And then really quickly, is there anything else that parents need to know before they send their little ones off this summer?
I think that they should trust that if the children have been vaccinated, that it is a safe time to return back to normal activities. And I think it's a great time to get kids back into doing what kids like to do, and that's having fun during the summer.
All right. Thank you so much, doctor, for joining us this afternoon. And for more stories just like this one, head over to our website, kctv5.com/HCA Midwest.